This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Well, we should start at the beginning. These are a couple of our affiliated hospitals, our major affiliate hospitals, Mass General and Brigham and Women's, and we are affiliated with Harvard Medical School, the teaching hospital. So we'll start with some program basics and overview of the program as a whole, some of the main things that we do in our program as far as didactics, our program highlights, and we'll talk about our residents as well. So this is our beautiful facility here. It's in Charlestown, one of the neighborhoods in Boston. It is right on the water, and the land around is pretty nice. We have a lot of space for our adaptive sports patients to utilize the boardwalk and the water there. They're also using adaptive kayaks and canoes and going out on boat trips pretty regularly during the summer. So it's pretty cool to be able to see all that happening in real time. So for the basics of our program, like any other rehab, PM&R residency, you have to do a year, prelim year, followed by 3 years of PM&R focused residency. There are many fellowship opportunities, which I'm sure you've all heard about tonight. Sports being one of our most popular, but we do have pain and interventional spine, spinal cord injury, brain injury. We also at Spaulding now have had our inaugural year of amputee fellowship. There are neuromuscular fellowships. We have had residents going to cancer and pediatric rehab. Our most recent matches, we've had 2 residents that have gone into pain. Last year at Dartmouth Hitchcock and UC Davis, we've had, last year we had 2 match into sports fellowships, one here at Harvard Spaulding and one at Mount Sinai. We've also had a resident match in TBI at Pitt and neuromuscular medicine at MGH and Brigham and Women. And our residents are also very strong applicants for attending positions right out of residency. So that typically we have 8 residents, and last year 6 of them went into fellowship, but 2 have got jobs before they graduated and have actually already started working currently. So currently we're ranked number 3, and that's great. So like I said, we have 8 residents per year. We rotated in Boston's some of the major hospitals in the city. So MGH, Brigham and Women, that's where we spend a lot of our EMG time. So you'll either do 3 months at MGH or 3 months at Brigham and Women during EMG in your PGY 3 year. We also rotate at the 2 of the major Boston Veteran Affairs hospitals, Jamaica Plain and West Roxbury. West Roxbury for spinal cord injury, and Jamaica Plain for 2 more months of EMG as a PGY 4. And we also get to rotate in Boston Children's, which is great. It's one of the top ranked pediatric hospitals in the country. And we do a mix of outpatient clinics with the Boston Children's pediatric PM&R attendings. We also rotated all the different Spaulding satellites throughout the region. And that includes some pretty cool spots. We have an office in Foxborough that overlooks the Patriots football stadium. You see a lot of sports and spine patients there, and that can be pretty cool. So a pretty complete comprehensive exposure during residency year to all the various pathologies that you'll see in patients that come through rehab. a pretty significant spinal cord injury, TBI, stroke, burns. P&O is something we do pretty well. We have a really strong sports program, and pain and research as well. So for the basics, as a PGY2, you would do it's pretty inpatient heavy. Start with 8 months of inpatient and 4 months of outpatient as a PGY2. And as a PGY3, you do sort of move more to the outpatient world. You only have 3 months of inpatient, like I mentioned, 3 months of EMG, and then you have 2 months of electives, and 4 months of outpatient as well, which is distributed between spine, pain, and sports and MSK. And as a PGY4, you do 2 months of inpatient, 2 more months of EMG, you get 2 electives as well, and the rest is 6 months of outpatient. We kind of already went over this. This is basically where you'll be rotating through at our program. For our call, largely it's 24-hour in-house call. It's much better than your intern year. As a PGY2, you definitely notice the call burden has significantly dropped moving into PM&R. But our call sort of grades down. So like as a PGY2, you do the most overnights and the most weekend call. And then as a PGY3 and 4, that slowly goes down. And as a PGY4, you no longer do overnight call. You are just doing a weekend supplemental call and short call, which is from 5 p.m. to typically 9, 10 at the latest, depending on how many admissions are going to be coming after 5 p.m. So call definitely gets much better as the more senior you get. Even as a PGY3, you're doing about half of the overnight calls that you were as a 2. And your weekend call is largely supplemental, which means you usually can get your work done and be out of the hospital by, I would say, 1 o'clock at the latest, most times. If you're on call during the weekend, we have typically we have 4 residents on weekends, 2 first and second call, and they handle up to 2 admissions each. And they stay until those admissions are done. If there are more than 4 admissions, the attendings take those. And then, like I said, the 2 supplemental residents, they do floor coverage, and then they're able to sign out in around noon and take off if their work is done. So for sign out, one of the great things I think we have about our program is for weekends, most of the time we have moonlighter coverage. So what that means is a moonlighter comes in at noon on Saturday and on Sunday, and you sign out tasks, follow-up tasks, and other things, FY patients and people that you're concerned about to the moonlighter at noon. And then if you're a supplemental resident, you're able to go home. And then the moonlighter covers the pager. They cross-cover the hospital between noon and then get relieved at 7 a.m. the next day. So that's really nice. Sometimes we don't have moonlighters, and the first call resident covers that overnight shift. And but otherwise, we have a pretty robust moonlighter program. So we're pretty well staffed. One thing I can mention as well too, which is appealing to a lot of people, is that as a PGY3, you are able to moonlight at Spaulding and take those moonlighter positions. You have to get your full MAS license and apply for that. So there are costs and time dedicated to filling out that application paperwork. But that is something that some residents do take advantage of and then participate in moonlighting at Spaulding. As a PGY4, you are able to moonlight without a full license at the VA hospital on SCI, and the VA is a home call. So if you're doing weekend moonlighting for that, you're just taking call from home. You'll get signed out over the phone and take your call from home, and you only go in if there are patients who are sick and need to be seen. And then weekends you would go in for weekend rounding, which is usually about a half day or so, sometimes less, depending on the census at the time. So for didactics, I will briefly turn it over to Dr. Beeling, who is our academic chief, who can briefly talk about our didactic program.
Thank you, JJ. Hi, everyone. Excited to talk to you tonight about didactics. We have didactics every Tuesday morning, and we're very grateful that the time is protected for the 4 to 6 hours that we have didactics. So you are not getting pages, you are able to focus on the material at hand. We follow an annual cycle for the curriculum, and each month we focus on a major PM&R topic, whether that is spinal cord injury, traumatic brain injury, pain, etc. And then the didactics, we have PM&R attendings come and talk, and then there are some resident-led sessions which allow us to practice our teaching skills. One didactic opportunity that I just want to highlight is our annual Anatomy Week. It's a special time every year. It happens at the end of July. And we start off in the mornings with our sports attendings come and talk to us about the anatomy of each joint in the body. And we review physical exam pearls and have hands-on portions where we practice the physical exam maneuvers on each other. We then transition in the afternoon to the Harvard Medical School cadaver lab. And we are able to see the prosections and do dissections of the cadavers if we want, and just like hammering home the anatomy. And it's led by a Harvard Medical School anatomist who is excellent. And then we also build in the ultrasound correlate so that we were able to match the cadaver anatomy to the ultrasound anatomy.
Thank you, Ali.
Oh, I think there's one more.
There is.
More slides. In terms of how our didactics are structured, they are multidisciplinary. So in addition to having the PM&R attendings, we have speakers from ortho, neurology, anesthesia, and rheum. And then it's also, we have therapists, so PT, OT, speech and language, nursing, and prosthetics will give us talks on their areas of expertise. And then we have a couple of series that occur every month, and that includes our research curriculum and journal club, which helps us prepare for doing research. We have a specific board prep curriculum, which includes SAE practice and mock oral boards. We have a big focus on spasticity with practicing ultrasound guided Botox injections and also doing the backflip and pump refills. We have a finance committee that talks about matters of personal finance for us. And then we also have teaching opportunities with the Harvard Medical students that rotate with us. And overall, I'd say the focus for our didactics are making them hands-on and interactive, as you can see in the pictures on the right.
Awesome.
Oh, there's one more.
Oh, we got more? Perfect.
Yep. So last but not least, we just want to highlight our ultrasound curriculum. So we actually have sessions where a complete Tuesday morning is dedicated to ultrasound of a specific joint. So we'll do knee one day, or hip another day, or shoulder. And it's led by a sports medicine attending. And the sports fellow will also come. They will demonstrate to us the ultrasound, and then we break up into small groups and just get that hands-on practice, which is exactly what we need. All right, thank you, everyone.
Thanks, Ali.
Spaulding, you have 5 minutes.
Excellent. So we have a resident continuity clinic that there's about 3 to 4 per clinic team, and you will have resident clinic 2 times a month, and you'll see patients post-discharge from TBI, stroke, and you'll be doing a lot of Botox injections and ultrasound guided injections for those patients as well. Residents go to both major conferences. It's usually just the 3s and 4s. Hopefully this year we'll all be able to go. Past couple of years have been strictly because of COVID. And you get 5 conference days designated specifically for conferences. So for our wellness curriculum, I did bring in Connie Sue. She can just chime in real quick about our wellness curriculum.
Hey everyone, I'm Connie. I'm a PGY3 at Spaulding, here to talk about wellness. So here at Spaulding, we don't think wellness should be, like a series of lectures about the importance of sleep and meditation and downloading a meditation app. We think it should be a time to hang out with our co-residents, bond, do fun activities, and de-stress. The wellness committee is made up of 4 to 6 residents. So we get to choose which activities we want to do, but anyone is welcome to join as long as they have an idea and they want to organize the event. On average, we have around 1 activity a month, sometimes more, sometimes less. Every year we do a welcome pizza dinner, we do paddle boating. It's like beautiful in Boston over the summer. We always do apple picking in the fall. Last year, we combined volunteer work and wellness, and we ordered dinner and we wrap presents for underserved communities. This year, we're going to try to do pickleball. That's coming up this Sunday. Go-karting, which will be extremely fun, cross-country skiing, and maybe we'll go back and do some axe throwing as well, which they've done in previous years. So we're really excited about all the activities coming up.
Thanks, Connie. We also have a lot of extracurriculars. We have our residents do PPEs, and we usually have a group of residents do the Boston Marathon coverage, which is pretty exciting, along with other sports coverage opportunities and volunteering opportunities. We have a READY community. It's residents educating and advocating for diversity and inclusion. And I will turn it over quickly to Krista to talk about this.
Yeah, hi everybody, I'm Krista, I'm a PGY4. So in general, we're a resident-led committee that's focused on like advocacy and bringing awareness and education to underserved and just sort of like minority populations. So it's both a curriculum and then service and just like learning opportunities. So these are just a few of the things that we've done over the past 2 years, including like pronoun badges, getting involved in the community and having high school students and various like educational program students come in and shadow and work with the residents. And then we've had multiple panels. We have a women and gender panel coming up where we're having multiple PM&R physicians come to talk to the female and women residents to give us a little bit more mentorship as we're going through the process. So just wanted to highlight that really quick.
Awesome, great work. So our residents live all over the city, and Boston's a pretty cool place to live. So come check us out. Some pictures of our hospital, and I'll leave the rest of the time. We're getting close to being out of time actually, to answer questions. These are some of our residents. And does anyone have any questions? This is where you can reach out to us. We are not able to get to any of your questions at this time. But thank you for having us, and I hope this has been informative and you've learned something about our program. So
We might have time for about 1 question.
Does anyone want
a question in the chat that says, is the ultrasound curriculum repeated every year? The answer is yes. So there are, I think, 5 to 6 sessions throughout the year. Each one's focused on a specific joint, so knee, shoulder, hip, etc. And then that curriculum is repeated every year. You have the opportunity to also be a teacher to train the other residents if you're interested in focus. That's not my jam, but other people are. so it's a really robust curriculum that's been also published now. So it's really great.
Awesome. Thank you so much, Spaulding.
Cool.